Bonjour à tous. Good morning, everyone. Je suis heureux d'être ici avec la Dr Tam et le Dr Njoo. Le ministre Leblanc se joint à nous virtuellement et le ministre Rodriguez est également des nôtres pour répondre aux questions sur les développements parlementaires. Fighting COVID-19 is a Team Canada effort. Right from day one, we've been working with all orders of government to keep people safe. And during this second wave, that's exactly what we'll continue to do. Yesterday, I had my 20th First Minister's meeting with the Premiers to discuss what Canadians need for the weeks and months to come. To begin with, it's vital that frontline workers have access to personal protective equipment. To date, the federal government has shipped almost 190 million pieces of PPE to the provinces and territories. At the same time, we're providing support staff who can make over 14,000 contact tracing calls a day. We're also ramping up our testing at national labs across the country to help the provinces and territories with their surge capacity. In this second wave, just like in the first, our government stands ready to help our partners across the country keep Canadians safe. La lutte contre la COVID-19 est un travail d'équipe partout au Canada. Dès le premier jour, on a travaillé avec tous les ordres de gouvernement pour vous protéger. C'est exactement ce qu'on continue de faire pendant cette deuxième vague. Hier, on a eu notre 20e rencontre avec les premiers ministres des provinces et territoires depuis le début de cette pandémie. On a discuté de ce que les Canadiens vont avoir besoin pendant les semaines et les mois à venir. D'abord, c'est essentiel que nos travailleurs de première ligne aient accès à de l'équipement de protection individuelle en quantité suffisante. Jusqu'à maintenant, le gouvernement fédéral a livré près de 190 millions d'articles de protection individuelle aux provinces et aux territoires. En parallèle, on aide aussi avec du personnel de soutien qui peut faire plus de 14 000 appels par jour pour la recherche de contacts et les laboratoires nationaux d'un bout à l'autre du pays aident à faire augmenter la capacité de dépistage. Dans la deuxième vague, comme dans la première, notre gouvernement est prêt à aider nos partenaires pour assurer la sécurité des Canadiens. COVID-19 isn't just a health crisis, it's an economic one, too. Workers and businesses across the country need support during this tough time. The fact is that the second wave has the potential to hit people really hard. So we're going to keep stepping up to help. Last week, I announced that we were creating the new Canada Emergency Rent Subsidy, which provides direct rent support to tenants. This is in addition to the extension of the wage subsidy and the expansion of the Canada Emergency Business Account. These programs have been and will continue to be a lifeline for small business owners. Just take Amarjeet Shanduk, who owns Taza Express in Brampton. When the pandemic first hit, Amarjeet worried about whether his business would survive. But by using the wage subsidy, the rent support program, and the Canada Emergency Business Account, he was able to keep his employees on the payroll and the lights on. We'll continue to be there for people like Amarjeet and for small businesses right across the country that create good jobs and make our communities stronger. La COVID-19 n'est pas juste une crise sanitaire, c'est aussi une crise économique. Les travailleurs et les entreprises de partout au pays ont besoin de soutien pendant ces moments difficiles. On sait que la deuxième vague pourrait frapper très durement et on est là pour vous aider. La semaine passée, j'ai annoncé qu'on allait créer la subvention d'urgence du Canada pour le loyer commercial, qui va directement aux locataires. Ce soutien s'ajoute au prolongement de la subvention salariale et à l'expansion du compte d'urgence pour les entreprises canadiennes. Ces programmes aident et vont continuer d'aider les propriétaires de petites entreprises. Ces entreprises créent de bons emplois et elles sont au cœur de nos communautés. In our fight against COVID-19, we need all the tools we can get. With over 4.5 million downloads, the free COVID Alert app is a powerful way to keep yourself and your loved ones safe. If you download the app and come into contact with a person who then tests positive for COVID-19 and also has the app, it will alert you to take action. This helps you to do your part to to stop the transmission of this virus. That's why 8 provinces now have the app fully up and running, and we'll continue to work with Alberta and BC to get them to come on board too. If you haven't already, I encourage you to go to the App Store or Google Play and download the app for free. Pour nous aider à lutter contre la COVID-19, nous avons plusieurs outils à notre disposition. Avec plus de 4,5 millions de téléchargements jusqu'à maintenant, l'application gratuite Alerte COVID est très efficace pour aider à vous protéger vous-même ainsi que vos proches. Le processus est très simple et protège votre vie privée. Si vous avez eu un contact étroit avec une personne ayant par la suite signalé un test positif, l'application va vous avertir. Après avoir reçu l'alerte, vous pouvez alors vous rendre dans un centre de dépistage ou vous isoler en attendant votre résultat. Cette application aide à empêcher la transmission du virus. Elle fonctionne maintenant pleinement dans 8 provinces et les discussions se poursuivent avec la Colombie-Britannique et l'Alberta. Alors, si ce n'est pas déjà fait, rendez-vous sur l'App Store ou sur Google Play et téléchargez gratuitement l'alerte COVID immédiatement. We must keep taking the fight against COVID-19 seriously. This pandemic is still a very real threat. For several weeks, you've been hearing me, the premiers, and public health officials urging everyone to double down on what we know works to flatten the curve and beat this second wave. Frankly, the numbers are still too high, and that has real consequences. Our frontline workers are at risk, our parents and grandparents in long-term care facilities are at risk, and our loved ones who have pre-existing health conditions are at risk. For businesses, many of which have just gotten back on the road to recovery, this second wave has pushed them to the brink once again. This is very serious, but we have the power to turn things around. So let's keep doing our part for each other and for the people that we love. On doit continuer d'être sérieux dans notre combat contre la COVID-19. Malheureusement, cette pandémie est une menace qui est encore bien réelle. Depuis plusieurs semaines, les premiers ministres des provinces et territoires, les responsables de la santé publique et moi-même demandons à tout le monde de redoubler d'efforts et de poser des gestes qui, on le sait, vont nous aider à aplatir la courbe et casser la deuxième vague. Le nombre de cas est encore trop élevé, et trop de gens sont encore à risque. Nos travailleurs de première ligne, nos parents et nos grands-parents qui vivent en centre de soins de longue durée et nos proches qui ont déjà des problèmes de santé. Pour les entreprises qui arrivaient enfin sur le chemin de la relance, cette deuxième vague menace encore de les ralentir. Je comprends votre inquiétude, mais on peut encore renverser la tendance. Alors continuez de faire notre part pour aider les autres et pour aider les gens qu'on aime. En tant que gouvernement, nous allons continuer d'être là pour vous. This morning, I spoke with Prime Minister Pashinyan of Armenia to express our concern about the situation in Nagorno-Karabakh. I told him that Canada will continue to work extremely hard with all our allies to put an end to the violence. I encourage all sides to engage in dialogue to find peaceful resolution to the conflict. This was echoed by Minister Champagne on his trip to Europe, which is wrapping up today. Minister Champagne's trip included a week of meetings with our allies to discuss the global fight against COVID-19. He also had talks about how we can find meaningful ways to support democracy in Belarus. Today, Minister Champagne met with opposition leader Svetlana Tsikhanouskaya to show our support for her and for the people of Belarus. We will continue to work with our international partners to ensure that the people of Belarus make sure their voices are heard. And finally, I want to take a moment to talk to kids out there across Canada. I know that these past 6 months or so have been really difficult for all of you, but I know many of you had birthdays, milestones to celebrate during these past months that were really difficult and a lot less fun than usual. No families, no extended families, no parties, no friends. These are things that kids are struggling with in this time of COVID. This weekend is my dad's birthday, but it's also my son Xavier's 13th birthday. Turning 13 is a big moment where you get to become a teenager and all the responsibilities that come with it, but it's also a time where friends really matter. And not having a party is tough. But as families, as Canadians, and as kids, we need to keep doing our part to keep safe, to protect our grandparents, to make sure that we're slowing the spread of COVID-19. We've asked an awful lot of everyone across the country, especially kids. But I want you to know that we're going to continue asking a lot of you because I know you're capable of it. We're there for you. Make sure you're leaning on each other, but know that we all need to do our part to keep people safe, even when it's our special day. Merci beaucoup tout le monde et je passe maintenant la parole au ministre Leblanc.
Thank you very much, Prime Minister. Comme le Premier ministre l'a mentionné, hier, on a eu la 20e rencontre des premiers ministres depuis le début de la pandémie. Ces rencontres sont particulièrement importantes dans le contexte actuel, car elles nous permettent de coordonner nos efforts pour mieux appuyer les Canadiens. Ce que nous avons exprimé aux provinces et aux territoires et que nous continuons d'exprimer, c'est que le gouvernement fédéral est là pour vous aider. Our government's main message to provinces and territories is and continues to be, we are here to support you and to support Canadians. We've done so through the $19 billion Safe Restart Agreement, which is helping provinces and territories improve testing capacity and purchase personal protective equipment. We've also set up a $2 billion Safe Return to Class Fund to better support provinces and territories as they adapt learning spaces, improve air ventilation in schools, increase hand sanitation and hygiene, and purchase more personal protective equipment and cleaning supplies. Accessing testing kits, medical equipment and supplies, and personal protective equipment is critical to provinces and territories in their response to the pandemic. We are here to support them and to support Canadians in this regard as well. As recently as Tuesday, shipments for gloves, face shields, and N95 masks were sent to provinces and territories. To be precise, as of today, we have sent to provinces and territories over 12 million N95 masks, over 43 million surgical masks, over 97 million pairs of gloves, over 7 million gowns, over 20 million face shields, over 8 million swabs, and 321 ventilators. Testing remains one of the most important tools we have to flatten the curve. We continue to work with provinces and territories to increase this important testing capacity. We're doing our part by ensuring they have what's needed so they can test Canadians quickly. Nous continuons d'aider les provinces et les territoires dans leur réponse à la COVID-19 via l'accord sur la relance sécuritaire, un investissement fédéral de 19 milliards de dollars et le Fonds pour un retour en classe sécuritaire, un investissement fédéral de 2 milliards de dollars et en achetant et distribuant l'équipement médical de protection personnelle et les kits de dépistage qui sont nécessaires aussi. Nous continuons également à faire notre part en nous assurant que les provinces et les territoires ont ce qu'il faut pour augmenter leur capacité tellement importante de dépistage. Nous allons continuer de travailler ensemble, comme le Premier ministre a réitéré hier soir, pour soutenir les Canadiens à travers notre pays. Et je passe maintenant la parole à Dr. Tam.
Bonjour tout le monde.
Hello, everyone.
There have been 191,732 cases of COVID-19 in Canada, including 9,699 deaths. Nationally, there are close to over 20,500 active cases across the country. Over the past week, labs across Canada have tested an average of over 77,000 people daily, with 2.4% testing positive. National daily case counts continue to rise, with an average of just over 2,300 new cases being reported daily during the most recent 7 days. Over the past week, there have been, on average, 870 individuals with COVID-19 in Canadian hospitals each day, and 20 deaths reported daily. The resurgence of COVID-19 cases affecting many parts of the country is concerning, and something we must keep top of mind to plan safer activities for ourselves and our families during the fall and winter. I encourage everyone to heed the advice of local public health authorities, as their recommendations are based on the local situation. In order to keep COVID-19 activity at a manageable level, particularly in areas experiencing high infection rates, restrictions or limitations may be imposed on higher risk settings or activities. But regardless of the local situation, if you have symptoms, even mild ones, stay home and self-isolate. As fall is upon us, I also want to remind everyone that this is the start of the influenza season. The flu shot provides protection against infection with influenza A and B viruses that are expected to circulate in the Canadian population this fall and winter, while COVID-19 activity continues. Although the flu shot doesn't provide protection against infection with the virus that causes COVID-19, it will help reduce the risk of you getting the flu before, during, or after a possible COVID-19 infection. Having both illnesses close together in time or at the same time could put you at higher risk for severe illness. Getting the flu shot protects you and those around you, providing you protection from infection and serious illness, and reduce the likelihood of you spreading the illness to others. By keeping you and others healthier, the flu shot is also an important prevention measure to help reduce the burden on Canada's healthcare system during this unprecedented time. Our best bet is to keep everyone safer is to layer on all the protections we have available. By following public health practices to reduce the risk of COVID-19 and making sure all our important vaccinations are up to date, we are doing our best to protect ourselves and others. And as an additional measure we can take to break the cycle of infection and help limit the spread of COVID-19, I encourage Canadians to download the COVID Alert app if it is available in your area. Thank you.
Bonjour. Avant de
Good day.
commencer, je prends le point
Before
du
I
Premier
begin,
ministre
I would like
pour
to
passer un petit message à ma fille
also
aujourd'hui.
take an
Bonne fête,
opportunity
Sandrine. Papa t'aime
to
beaucoup. Bisous.
wish a happy birthday to my daughter
Au Canada, il y a
Sandrine.
eu 191
In Canada, there have been
732 cas de COVID-19, dont 9
191,732 cases of
699
COVID-19 in
décès.
Canada,
À l'échelle du
including
pays, il y a plus de 20 500
9,699
cas
deaths.
actifs. Au
Nationally,
cours
there
de
are
la
close to
dernière
over
semaine, les laboratoires
20,500
canadiens ont
active cases
analysé
across the country.
quotidiennement les
Over
tests
the
de
past
dépistage de
week,
plus
labs
de
across Canada have
77
tested
000
an
personnes
average
en
of
moyenne,
over
dont
77,000 people
2,4
daily,
ont reçu
with
un résultat
2.4
positif.
testing
Le
positive.
nombre total de cas quotidiens
National
au
daily
pays
case
continue
counts
à
continue to
augmenter
rise,
et environ
with an average
2300
of
nouveaux
just
cas en
over
moyenne ont été signalés au cours
2,300
des
new
7 derniers
cases
jours.
being reported
La
daily
dernière
during
semaine,
the most
il y a
recent
eu en
7
moyenne
days. Over the
870
past
cas
week,
de la
there have been
COVID-19
on
dans les
average
hôpitaux canadiens
870
et 20
individuals
décès
with
signalés
COVID-19 in
quotidiennement.
Canadian hospitals each
La
day and
résurgence
20
des cas de
deaths reported
COVID-19
daily.
de nombreuses
The
régions du
resurgence
pays
of
est
COVID-19
préoccupante.
cases affecting
Et
many
nous
parts
devons
of
la
the country
garder à
is
l'esprit en
concerning and
prévision
something we must
d'activités
keep
plus
top
sûres
of mind
pour
to
nous
plan
et
safer
notre
activities
famille
for
pour
ourselves
l'automne et
and
l'hiver.
our families during
Nous
the fall and
encourageons
winter.
tout le monde à suivre le
I
conseil
encourage
des
everyone
autorités
to
locales
heed the
de
advice
santé
of local
publique,
public health
car elles font
authorities
leurs
as their
recommandations sur les
recommendations are
situations
based
locales.
on the local
Afin de
situation.
maintenir la transmission
In
de la
order to
COVID-19
keep
à un
COVID-19
niveau
activity
gérable,
at a
en
manageable
particulier
level,
dans une région où les taux
particularly in
d'infection
areas
sont
experiencing
élevés,
high
des
infection
restrictions
rates,
peuvent être imposées
restrictions or
à l'égard des
limitations may be
situations ou
imposed
des
on
activités
higher
très,
risk settings
très
or
risquées.
activities.
Mais quelle que soit la
But
situation dans
regardless
votre
of the local
région, si
situation,
vous avez des symptômes,
if you have
même faibles,
symptoms, even
restez
mild
chez vous
ones,
et
stay
isolez-vous.
home and
Comme c'est
self-isolate.
le début de l'automne, c'est aussi
As
le début
fall
de
is
la
upon
saison
us, I
grippale.
also want to remind
Le
everyone
vaccin
that this is the
antigrippal
start of the
protège
flu
contre
season.
l'infection au
The
virus
flu shot
de
provides
l'influenza
protection
A
against
et B
infection
qui,
with
selon les
influenza
prévisions,
A and B
circuleront
viruses
au
that are
Canada cet
expected to
automne et cet
circulate in the
hiver
Canadian
en même temps
population
que la
this
transmission
fall and
de la
winter,
COVID-19.
while
Le
COVID-19
vaccin
activity
antigrippal ne
continues.
fournit aucune
Although the
protection
flu shot
contre
doesn't provide
l'infection au
protection
virus à
against
l'origine de la
infection
COVID-19,
with the virus that
mais
causes
elle aidera à
COVID-19,
réduire
it
votre
will
risque
help reduce the
d'attraper
risk
la
of you
grippe
getting the
avant,
flu
pendant ou
before,
après avoir
during,
possiblement
or after
contracté
a
la
possible
COVID-19.
COVID-19
Le fait
infection.
d'avoir les deux maladies,
Having
plus
both
ou moins
illnesses
en même temps
close
ou
together in time
simultanément,
or at
peut
the
vous
same
exposer
time
à un risque
could
plus
put you at a
élevé de
higher
maladies
risk for
graves.
severe illness.
En vous faisant vacciner contre la
Getting the
grippe,
flu
vous
shot
vous protégez
protects you and
et vous
those around
protégez les
you,
gens qui vous entourent, car le vaccin peut
and it
prévenir une
provides
infection
you
ou
protection
une
from
maladie grave
infection and
et ainsi
serious
réduire le
illness,
risque de
reducing
transmission,
the likelihood
parce
of
qu'il
you
vous
spreading the
permet
illness
à
to
vous
others.
et aux autres de
By
rester en
keeping you
meilleure
and
santé.
others
Le
healthier,
vaccin antigrippal
flu shot
est également une mesure
is
de
also an
prévention
important
importante
prevention
qui
measure
contribue à
to
réduire
help
la charge
reduce the
susceptible
burden
de peser sur le
on
système de
Canada's
santé
healthcare
canadien
system
pendant cette
during this
période
unprecedented
sans
time.
précédent. La meilleure chose à faire pour nous
Our best
protéger
bet
tous est
to keep
d'appliquer toutes les
everyone
mesures de
safer
protection
is to
dont nous
layer on
disposons.
all of the protections we
L'adoption des
have
pratiques de
available
santé publique
by
pour
following
réduire le
public
risque de
health
propagation de la
practices to reduce the
COVID-19
risk of
et la tenue à
COVID-19
jour de tous nos
and
vaccins
making sure
importants
all
sont
our
les meilleurs
important
moyens de
vaccinations
nous
are up to
protéger
date.
et de
We are
protéger
doing our
les
best
autres.
to protect
Comme
ourselves
autre
and others.
mesure, nous
And
encourageons
as
les
an additional
Canadiens
measure
à
we can
briser le
take to
cycle
break the
d'infection
cycle of
et à
infection
contribuer
and
à
help
freiner la
limit the
propagation de
spread
la
of
COVID-19
COVID-19,
en téléchargeant
I
l'application
encourage
Alert
Canadians to
COVID
download the
s'il est
COVID Alert
disponible
app
dans votre
if it is
région.
available in your
Merci.
area. Thank you.
Thank you, Dr. Njoo. For the question period today, the Prime Minister will answer questions for 20 minutes. Doctors and ministers will remain available afterwards. Le Premier ministre répondra à des questions pour 20 minutes. Les docteurs et ministres seront disponibles par la suite. On va commencer par le téléphone aujourd'hui. Opérateur, c'est à vous.
Thank you. Merci. Première question, Hélène Buzetti,
First
Le
question
Devoir.
from Hélène
À vous.
Buzetti from Le
Oui,
Devoir.
bonjour, Monsieur Trudeau. Vous avez
Hello,
parlé
Mr.
à
Trudeau.
plusieurs reprises là, de la
You have
nécessité
repeatedly
d'imposer des
spoken
normes
about
nationales
the need
dans les centres
to
d'hébergement
set
pour
up
personnes âgées.
national
Vous en avez parlé
standards
plusieurs
for
fois, mais vous
long-term
n'avez
care
jamais
centers
vraiment
for seniors.
précisé ce que vous
But you
aviez
have
en
never
tête.
really
Alors, pouvez-vous nous
specified
donner des
what exactly you
exemples
have in mind.
d'éléments
Could
de
you give
secteurs pour
examples
lesquels
of
vous pensez des normes
things
pourraient
that
être
you
édictées?
think
D'abord, on sait,
should be
excuse-moi.
established for certain
D'abord, on
sectors?
sait que les
Answer.
tragédies qu'on a vécues dans
First
nos
of all, let me
centres
say that the
de longue
tragedies
durée, nos
that
centres de
we
soins
have
d'aînés,
experienced in our
ont
long-term
été
care centers
terribles ce printemps
for
et
seniors
malheureusement, on
were
est encore à
terrible
risque dans
this
cette deuxième
spring,
vague
and
d'en
unfortunately,
voir
in the
d'autres.
second wave,
On a vu
we
aussi
are at
que
risk
dans
of seeing
différentes
more of
provinces,
this.
ils ont eu
In a
différents
number
niveaux
of
de
provinces, we have
réussite
seen
de
that there were
gérer
varying levels
la
of
santé de nos
success
aînés.
in
Et
managing
comme
our
première
seniors'
étape, ce
health.
serait bien, et ce qu'on est en train
And so
d'encourager,
the
c'est que
first step,
les
something that
différentes
we would
provinces
encourage,
regardent
would
ce
be
qu'ils font les uns les autres et
for
s'inspirent
provinces
des
to look
réussites
at
ou
what
des
other provinces and
défis
territories are doing
auxquels
and
leurs
to
voisins
draw
pourraient
inspiration
faire face pour améliorer
to
leur
help
système à eux.
their
Ça, c'est
neighbors
une première étape qu'on est en train de
overcome
regarder
shared challenges.
maintenant
This is
ensemble. Et il y
a
a beaucoup
first
de
step
premiers
that we are
ministres qui
now
sont très
considering
intéressés
together.
par ce que les
Some
autres sont
premiers
en train
are
de faire.
very interested in
Une
what
des
other
choses
provinces
qui
are
est devenue
doing.
extrêmement claire, c'est que
Something that has
le rôle
become tremendously clear
d'agents chargés de prévention
is
des
that
infections
there are
et
agents who are in
à
charge
l'intérieur
of
de ces
monitoring
institutions-là
infection,
est particulièrement importante et
and that
de
role
discuter,
is
par
extremely
exemple,
important
du nombre
in
d'agents
long-term
que ça
care
prendrait par
centers.
population. C'est des conversations qu'on pourrait avoir.
These are some of the
Notre
conversations
but,
we could have.
évidemment, c'est d'assurer que
Obviously,
tous les
our
aînés
goal
de notre
is to
pays,
ensure that
où
all
qu'ils
seniors
soient
in our country,
dans
no
notre pays,
matter
aient
which
la même
region they live
protection
in,
et
have the
un
same
sens de
protection
sécurité dans
and
leurs
have a
institutions et
sense of
surtout que leur
safety
famille le
in their
sache aussi.
center,
Je
and
respecte
that
tout
their
à fait
family
les champs de
also feel that
compétences des
same
provinces,
safety.
mais quand
I
on parle
have
de
full
dignité et
confidence in the
santé
authorities
et
in our
surtout la
provinces.
vie des
But
gens,
when we are talking
il n'y a
about
pas de champ de
safety
compétences.
and
On
above all
doit tous
people's
travailler
lives,
ensemble pour
we cannot
assurer
take
que
any
nos
risks, and we
aînés
all must work together to
sont
ensure
protégés,
that our
sont
seniors
bien en vie
are
Et c'est exactement ce qu'on va
living
faire.
well and are protected, and that is exactly what we will do.
Oui, alors
Follow-up
donc,
question.
doit-on comprendre que ce que vous avez en
Should we
tête quand vous
understand
parlez
that
de normes nationales, c'est
when you talk about
spécifiquement
national
en lien avec
standards,
la pandémie et donc
that
vous vous
these standards
intéressez
are
pas nécessairement à
specifically
plus long terme de
in
dicter
line
des
with
normes sur,
or
je sais
based
pas moi,
on
les
the
ratios
pandemic?
personnels
What
soignants,
about
patients, le nombre
ratios
de bains par
between
semaine, la
orderlies
qualité de la
and
nourriture.
patients? What
Donc,
about
vous
food quality?
êtes vraiment juste
What
préoccupé sur
about
la
cleanliness?
situation de la pandémie?
Are
Bien,
you really only
évidemment,
concerned
ici, dans
with
cette
the
pandémie,
situation
notre
given the
grande
pandemic?
préoccupation, c'est maintenant.
Answer.
C'est les aînés
Well,
cet
of course,
automne,
given the
c'est
pandemic, our
les aînés qui
biggest
pourraient
priority
souffrir pendant
is the present
une
moment.
potentielle, une autre vague après
We know
le temps des
that
fêtes. Donc,
there could
on est
be
là
a
pour
potential
travailler immédiatement
additional
pour
wave
protéger les
after
gens.
the
Ça faisait
holidays.
d'ailleurs
So
partie
we are
du 19
prioritizing
milliards de
protecting
dollars
people.
qu'on a envoyés aux
We
provinces
have
pour
sent
une
$19
relance
billion
sécuritaire.
to
Mais
provinces
évidemment,
for safe
cette
restart.
pandémie a mis au jour,
But of course,
mis au clair
this
énormément de
pandemic has brought to
vulnérabilités
light
qui existaient déjà dans nos systèmes pour nos
huge
aînés à travers le
weaknesses
pays.
that
Et je pense
exist
que
in care
de
centers
prendre
for our seniors
l'occasion
across the
de cette
country.
pandémie pour
I think that this
réfléchir à
pandemic
comment on
has
peut
given
mieux
us an
faire
opportunity to
pour
better reflect
protéger
on
nos aînés à
how we
travers le
might
pays.
better
C'est
protect our
quelque chose de
seniors
très
in Canada.
responsable qu'on devrait faire
That
ensemble
is
et
something
c'est une
extremely
conversation
responsible that
qu'on
we
va
must all do
avoir,
together,
qu'on va
and that is a
continuer d'avoir
conversation that we are
avec les
having
provinces
and
et
will
territoires.
continue to have with provinces and
Thank you.
territories.
Operator, next question on the phone.
Thank you. Merci. Next question, Brett Forster, APTN National News. Line open.
Hello, Prime Minister. This lobster conflict out east could play out across the Maritimes in the future as more First Nations plan to fish for a moderate livelihood. The chief there wants you to get involved. Will you do so? And if not, what mandate are you giving the fisheries minister to resolve this conflict?
Our government has been very much involved and will continue to. This is a situation that is extremely disconcerting and of real concern. That's why we're calling for an end to the violence and the harassment that's happening. We need to make sure that our security officials, our police are there to make sure everyone is protected as well. I understand the concerns and the conflict going on right now. But we need to find a solution. We need to find a path forward that recognizes the inherent and long-standing rights reaffirmed 21 years ago of Indigenous people for a modest livelihood. And we need to make sure that that fits within an important commercial activity in the Maritimes, that is fishing. This is not going to be an easy thing to resolve, but we will work together. And we will make sure that we all move forward on a path of reconciliation and greater prosperity for all. Évidemment, c'est une situation extrêmement préoccupante qu'on voit dans les maritimes avec les pêcheurs et les pêcheurs autochtones. Nous sommes tout à fait engagés dans la résolution de cette situation. Nous appelons d'abord pour du calme, pour du dialogue, pour une fin à tout acte de violence ou d'harcèlement. Et nous attendons aussi que les autorités policières fassent leur job pour s'assurer que tout le monde soit protégé. Nous allons évidemment continuer de travailler vers la réconciliation avec les peuples autochtones en reconnaissant les droits qu'ils ont, qui sont établis depuis bien longtemps à un certain niveau de pêche. Nous devons créer des nouveaux systèmes et nous devons trouver une façon d'avancer qui fonctionne pour tout le monde et nous allons le faire.
Thank you. Opérateur, prochaine question au téléphone.
Thank you. Merci. Next question, Jean-Paul Tasker, CBC News. Line open.
Just a second. Was there a follow-up for the Indigenous question?
Is Mr. Foster still on the line?
Yes, one moment, please. I'll bring him back.
Here, can you hear me?
Mr. Foster, go ahead.
Hi. Thank you. Yeah. As a follow-up on the topic of Indigenous rights, you know, from Wet'suwet'en territory to Caledonia, and now Nova Scotia, your ministers have been going coast to coast, negotiating these things while also putting out fires. quite literally in some cases. So my question is, why does it always take crises like these to get Canada to the table?
Well, what we have actually seen over these past 5 years is a tremendous amount of partnership and work right across the country where there haven't been crises. Obviously, when there are crises, we need to respond to them, and we will. But we've seen thousands of Indigenous kids starting school years in new schools. We've seen a lifting of well over 90 long-term boil water advisories, many of which have been in place for decades. We've seen significant progress on settling land claims and restoring and fixing historic injustices. We have made significant progress over the past 5 years, but there is always much more to do. We're also reaching a point where it's not just up to the federal government to be making changes along the road to reconciliation. The federal government continues to move forward on protection of languages, protection of child and family services, and ensuring we're keeping Indigenous kids in their communities when they're at risk. But we're also talking about moving forward on Indigenous health legislation, and that's a meeting that's going on right now. So our work will continue, and yes, it will not be easy, and there will be moments of tension, but I think we all need to commit ourselves and recommit ourselves as Canadians to reconciliation. That means all different orders of government, not just the federal government. That also means all Canadians. Understanding the systemic discrimination, systemic racism that has afflicted far too many Indigenous peoples and visible minorities for far too long, means also looking at how we change those systems and what we change about ourselves and our actions. And it's not going to be an easy conversation, and it's one that is going to have setbacks and challenges. But if we are committed to being the kind of country we like to imagine ourselves to be, always ready to improve, always ready to learn, always ready to be there to defend each other's rights, then we have to keep doing the hard things. The road to reconciliation is difficult, but it is one that we will all walk together. Je pense qu'il faut souligner que depuis 5 ans, on a fait énormément de progrès en matière de réconciliation. En termes d'investissement en santé, investissement communautaire, investissement en éducation à travers le pays dans les communautés autochtones. On est allé de l'avant avec la protection pour les langues autochtones, la protection pour les enfants qui vont pouvoir rester dans leur communauté quand ils sont à risque. On a d'autres projets par rapport à des projets de loi sur la santé pour les Autochtones. Et des nouvelles approches qui sont malheureusement extrêmement nécessaires, comme on a vu avec la situation de Joyce Echequan. J'ai eu le privilège d'ailleurs d'échanger ce matin avec le grand chef et plusieurs chefs autochtones du Québec pour parler de la situation de Joyce et de sa famille et du travail que nous devons tous faire pour améliorer la situation. Et on a beaucoup fait en termes de gouvernement fédéral, mais il y a plus qu'on doit faire en tant que Canadiens. Et ça implique tous les différents ordres de gouvernement et même tous les Canadiens. Nous devons tous faire le travail difficile d'améliorer notre pays, de contrer le racisme systémique et de créer un pays qui est réellement à l'image de ce qu'on imagine. Un pays juste, et ouvert, généreux, avec la compassion pour les autres. Nous avons du travail à faire, mais nous allons le faire ensemble.
Merci, opérateur. On va prendre une dernière question au téléphone.
Thank you. Merci. Next question, Jean-Paul Tasker, CBC News. Line open.
Yeah, good afternoon, Prime Minister. I also want to ask you about the situation in Nova Scotia. Chief Mike Sack said yesterday it's really not good enough for people like you to tweet about the vandalism and condemn it. He wants the federal government to come to their aid in what is turning out to be a violent standoff. He says the RCMP to this point have been useless. Even this morning, it seems like there's a lot of talk about this. But what more in concrete terms will you do to ensure the safety of these Big Maw fishermen? It seems like what Ottawa's been doing to this point really hasn't done much to keep the peace.
On the contrary, we've been extremely active in trying to resolve this, both behind the scenes and in engaging directly with people. That's why we've called for de-escalation, called for dialogue. We are expecting the RCMP and police services to do their jobs and keep people safe. I think there's been some concern that hasn't been done well enough, and that's certainly something we will be looking at very closely. But we recognize the rights of Indigenous communities to moderate livelihood fishing, and we will ensure that we're moving forward in a way that recognizes these rights that have long existed and need now to be put into place.
Following up.
Yeah, Indigenous Services Minister Mark Miller will meet today with Indigenous leaders to discuss systemic racism and inequality in the country's healthcare system. What do you hope this will meaningfully accomplish? And is the federal government prepared to withhold healthcare funding to the provinces and territories if there isn't some sort of plan there to address the discrimination that so many First Nations, Métis, and Inuit peoples are facing when they're accessing care?
Right across the country, all premiers have condemned racism, and there's still more work to do, obviously. But we are confident that we're going to be able to make significant improvements in the healthcare accessed by Indigenous peoples. But we're not doing it unilaterally. As we did with the question of child and family services, we'll be sitting down in partnership with Indigenous communities, Indigenous leaders, to help design the principles that should underlie better health outcomes and better health services for Indigenous peoples. That's an important first step, and we will continue to work with them in partnership and make sure that we're making these changes. It's too quick to make leap to conclusions about what we might do if it doesn't happen. I am confident that we're going to be able to make significant improvements hand in hand with provinces and territories in improving health care and health outcomes for Indigenous people right across the country. Je pense que c'est important de reconnaître que tous les provinces et territoires ont reconnu qu'il faut lutter contre le racisme. Et donc, je m'attends à ce qu'on améliore les situations pour les peuples autochtones dans le système de santé. Mais la première étape, c'est d'abord travailler avec les communautés autochtones, les leaders autochtones pour parler de ce qu'ils veulent, comme on a fait dans nos projets de loi antérieurs qui ont amené des grands changements au niveau de la protection des enfants, au niveau des langues. On va travailler avec eux pour créer des paramètres et des principes qui vont nous guider à travers le pays. Et je suis confiant qu'on va pouvoir avoir des meilleurs résultats en travaillant avec les provinces et territoires pour les peuples autochtones à travers le pays.
Merci. On va maintenant se tourner vers la salle. Première question. First question.
Chase with the Globe and Mail. I wanted to ask you about your conversation with Turkish President Erdogan. Apparently you talked to him today. His government's been very upset with you for suspending military export permits, shipments to Turkey. These include, of course, the target acquisition gear for airstrikes that Armenian Canadians are worried is being used against Armenians in the Nagorno-Karabakh conflict. So not only what did President Erdogan ask of you, but why is Canada still shipping military gear, target acquisition equipment to Turkey, even though there's an arms embargo that you put in place last year?
First of all, I was very pleased to speak with Prime Minister Nikol Pashinyan of Armenia this morning. I am scheduled to speak with President Erdogan of Turkey a little later today, in which we will certainly be discussing the export permits that Canada has suspended because of concerns that they have been used by Azerbaijan in the Nagorno-Karabakh conflict. I will express how important it is for Canada and for our allies around the world that there be a de-escalation of the violence in the region and impress upon Turkey how important it is to encourage people to get back to the table and not continue to participate in the violent conflict ongoing right now.
Louis Blouin de Radio-Canada, vous avez évoqué cette loi sur la santé des Autochtones sur laquelle votre gouvernement planche. Qu'est-ce qui vous fait croire que cette fois-ci, il n'y aura pas de conflit de juridiction avec le Québec? Parce qu'on a vu qu'avec C-92, c'est contesté en cours au niveau de la loi là, sur les pouvoirs en matière de protection de l'enfance. Alors, qu'est-ce qui vous fait croire qu'avec cette loi sur la santé des Autochtones, ça va être différent?
On a souvent des conversations sur les champs de compétences avec les différentes provinces, mais ça a été souligné plusieurs fois qu'en matière de santé pour les Premières Nations, c'est le gouvernement fédéral qui est responsable. Et nous allons donc travailler sur cet enjeu avec les Autochtones. On comprend que la densité de population et les régions éloignées dans lesquelles se trouvent beaucoup de communautés autochtones exigent qu'il y ait quand même accès à des services livrés par le provincial. Mais je pense que c'est tout à fait légitime de se poser des questions, particulièrement suite au décès de Joyce Echaquan et la tragédie à laquelle fait face cette communauté, qu'on ait des conversations sur comment améliorer les enjeux de santé pour les services de santé pour les peuples autochtones. C'est quelque chose dont le premier ministre Legault a parlé d'ailleurs. On a regardé aussi les rapports de la commission Vient et nous allons continuer de travailler ensemble parce que je sais que tout le monde veut améliorer le système pour tous les Canadiens, particulièrement pour nos peuples autochtones, les peuples autochtones.
Indigenous peoples.
Thank you. Next question.
Michael Couture with Global National. Prime Minister, according to the National Council of Canadian Muslims, every mosque in downtown Toronto has faced a credible threat. And several groups are asking you to establish a national plan to dismantle white supremacist and neo-Nazi groups. I wanted to know if and when you will commit to doing that.
We have been extremely concerned with the rise of intolerance, of anti-Semitism and Islamophobia, of racially based violence, of white supremacist groups, of far-right extremism. We have seen increased violence and threats of violence, not just on the internet, but in public and in particularly against religious institutions. We put in place an increased funding a number of years ago for better protections and security systems for vulnerable places of worship, but we know there is much more to do. Our intelligence agencies remain extremely concerned with the safety of Canadians from violent ideologies and particularly white supremacy and intolerance. We're going to continue to work very hard to keep Canadians safe. Discrimination and hatred has no place in Canada, whether it's online or in person. We will continue to stand up to protect Canadians.
Thank you. Next question.
Kevin Gallagher, CTV News. Prime Minister, can you be specific about the norms you want to equalize for long-term care facilities across the country? And what do you say to criticisms that this could infringe on provincial jurisdiction?
Well, first of all, the federal government has no jurisdiction over the running of long-term care homes in this country. So we don't have a baggage of experience as to what works best and what doesn't. That's why our proposal around national norms is very much around sharing best practices, first and foremost, between provinces. We've seen varied outcomes in various provinces around our seniors. And I think every Canadian can understand how important it is to make sure that all of our vulnerable senior citizens are properly protected, regardless of which province or territory they happen to live in. I think if this pandemic has shown us anything, it's that there are gaps that have long existed and cracks within which our most vulnerable can slip in our institutions. And to not take the moment of this crisis to reflect on how we can improve outcomes for everyone would be completely irresponsible. We made a commitment to protect Canadians. Every government has a responsibility to protect Canadians. And that's why we look forward to working with provinces across all jurisdictions to look at how we can ensure that every single senior, that every family member thinking about putting their mom and dad into long-term care can be reassured that they'll be well taken care of, that they'll be safe. Obviously, I respect provincial jurisdiction in running those institutions, but we've seen that those institutions haven't done a good enough job in this pandemic particularly, but in a long-standing challenge. This is a moment for us to step up and reassure Canadians that their loved ones, that they themselves, as they advance in age, won't be left aside, won't be made vulnerable. We need to make sure that every Canadian is protected. That's one of the roles of the federal government, and we're happy to work with the provinces to ensure that we can look Canadians in the eye and say, no matter where you live, your loved ones will be well taken care of. Je pense qu'on a tous appris
I think that we have
pendant cette
all
pandémie
learned
que nous devons faire
during
mieux.
this pandemic
Nous
that
devons
we
faire
must
mieux
do
pour nos
better.
aînés,
We
pour les
must do
personnes
better
les
for
plus
our
vulnérables.
seniors, for
Oui,
the
cette
most
pandémie a
vulnerable.
démontré
And
des failles dans le
this
système qui ne
pandemic
sont
has
pas nouveaux,
pointed out
qui
shortcomings in
existent
the
depuis
system
longtemps.
that are
Et
nothing
nous
new and that have
devons de pouvoir
existed
regarder tous
for
les
some
Canadiens
time.
dans les yeux pour leur
And we must
dire,
be able to look all
on va prendre
Canadians in the
soin
eye
de vos
and
papas, de
tell
vos
them,
mamans,
we will take care
de
of
votre
your
famille,
moms and dads,
de vos
of
proches.
your family, of your
On va
loved
faire
ones.
ce qui est nécessaire pour les garder en
We will do what
sécurité,
is
pour
necessary
bien
to
les
keep them
soigner, pour bien les
safe,
protéger.
to make
Ça, c'est la
sure they are well
responsabilité
cared
de
for.
tous les paliers de gouvernement
That is a
de
responsibility
protéger les
of
Canadiens.
all levels of government
Évidemment,
to
le
protect
gouvernement
Canadians.
fédéral n'a pas la
And
juridiction
of course,
sur la
the federal
gestion
government does not have
de nos
jurisdiction
CHSLD ou
over the
de nos
management
centres
of our
de longue
long-term care
durée.
centers.
Mais nous avons une
However,
responsabilité
we have a
de travailler avec
responsibility
les provinces
to
pour
work
s'assurer
together with
que d'une
provinces
province à l'autre,
to make sure
on est en train de protéger
that
nos aînés.
in one province or another, we
C'est
are
pas vrai
protecting our
qu'on peut
seniors.
dire que, ah non, c'est vrai, mais si vous êtes dans cette juridiction-là, on va
We
accepter que
can't
vous
just
soyez
say,
moins bien
oh, well,
soignés, que
since
vous
you're in
soyez
that
moins bien
jurisdiction,
protégés.
it's acceptable for
Et
you
on
to
a
be
vu
less well protected
que
or
les
less well
résultats
cared
sont
for.
différents à travers le pays.
Because
Les
we have
différentes
seen
approches,
that
c'est un des bienfaits du
performance
fédéralisme,
varies
c'est
from
qu'on
one
peut
region
voir
to
ce qui
another.
fonctionne dans d'autres régions et l'amener dans notre propre région. Il y a des
Provinces
régions du
have an
Canada où
opportunity to look to
la
their
crise
neighbors
dans
to
les,
see
dans
what
les
works
centres de
well
longue
or
durée
less well.
est beaucoup moindre que dans d'autres. Et ce
The
serait
performance
carrément
in some long-term
irresponsable
care centers is much
de ne
poorer
pas
than in others,
regarder
and it
attentivement
would not be
qu'est-ce qu'ils ont
responsible
fait, comment est-ce
not to
qu'on peut
look at this
mieux
closely
faire pour
and to
protéger
ask,
nos aînés.
what did they do differently and what
Donc
can
c'est
we
ça
do
que le
better
gouvernement
to
fédéral
protect
va
our seniors?
encourager,
And that
parce
is
que la
why the federal
protection
government,
des
or
Canadiens,
rather that is what the
c'est la
federal
job de nous
government
tous.
will encourage, because taking
Yeah,
care of
last
seniors
question.
is all of our
I'd just like to
responsibility.
ask you about the ambassador from China's comments yesterday. Many people are interpreting them as a threat against Canadians in Hong Kong. The ambassador seemed to say that was open to interpretation. So I want to know, how do you interpret the comments and what is the government doing to respond?
As a government, we've been very, very clear that we will stand up for Canadian interests, and we will stand up loudly and clearly for human rights all around the world, whether it's talking about the situation faced by the Uyghurs, whether it's by talking about the very concerning situation in Hong Kong, whether it's calling out China for its coercive diplomacy. These are things we will continue to do. We will make sure that China knows that not only are we standing up for human rights and calling on a safe return of the two Michaels who've been arbitrarily detained, but we stand with allies around the world, from the United States to Australia to Great Britain to European nations to many nations in every corner of the world who share these concerns. We don't look to escalate, but we will continue to ensure that Canadians know we're standing up for our rights, for our principles, for our values, and mostly, we continue to stand up for Canadians.
Merci, c'est tout le temps que le Premier ministre a pour nous aujourd'hui. On va continuer avec des questions au téléphone pour les docteurs et les ministres. Opérateur, c'est à vous.
We will continue with the other ministers.
Thank you. Merci.
the
Prochaine
doctors.
question.
Thank you
Émilie
very much.
Bergeron,
Next
Agence
question from
QMI.
Émilie
À vous.
Bergeron from QMI.
Oui, bonjour. Peut-être une question pour Dr. Tam
I have
et
a
Dr.
question
Njoo.
perhaps for Doctors Tam
Concernant
and
l'Halloween, là,
Njoo.
plutôt ce matin, cette semaine, vous avez dit qu'elle allait
Earlier
avoir
this week,
des lignes directrices.
you
Est-ce
said
qu'on peut avoir une
that
idée un
there
petit
would
peu plus
be
claire des lignes
guidelines
directrices que vous allez émettre
published.
à
Can you
ce
give
sujet-là,
us
maintenant qu'il y a certaines
an
provinces
idea of the new
comme le
guidelines
Québec
you will
qui ont
be
pris leur
announcing,
décision?
given that certain provinces have already made their decisions? Answer.
Bonjour, c'est Dr. Njoo. Dr.
Good
Tam
day,
et
this
moi,
is
on a
Dr.
déjà,
Njoo.
je pense, passé des commentaires sur l'Halloween. Je pense que
Dr.
l'Halloween,
Tam
c'est
and
une
myself
occasion
have
très
already
importante pour tout le monde.
shared these new
Avant, j'ai dit que
guidelines.
c'est
They're
important pour
concerning
les enfants, mais
Halloween.
je pense que c'est aussi important pour les adultes, pour les parents.
We were saying that
Mais je
Halloween
pense
is
avec,
important for children, but also
la
for
COVID-19,
adults.
il faut pratiquer d'une
When it
façon
comes to
sécuritaire
COVID-19,
selon
we have to practice
les
our
consignes
activities
des
in a
autorités de
safe
santé
way,
publique à l'échelle locale,
respecting
parce que
local
la situation,
authorities'
c'est
advice,
différent d'une région à
because as
l'autre
we
au
know,
pays.
situations
Je
vary
pense qu'il y a
from
quelques
one region
principes.
to another in the
Dr. Tam a
country.
déjà mentionné peut-être des
There are
moyens
some
pour
principles
donner les
that
bonbons aux
Dr.
enfants
Tam has
d'une
already
façon
mentioned. For
sécuritaire.
example, ways
Moi, je
to
pense
distribute
que
candy
pour les
to
enfants,
children in
aller
a
dans la
safe
rue,
way.
dehors, pour aller d'une maison à l'autre, ça peut aller avec les bonnes
Kids
mesures de
walking in
santé
the street
publique,
from
aussi
one house
peut-être
to another,
la
as far as I
disponibilité
can
de
see,
désinfectants
is
pour les mains,
safe
tout ça.
as long
Chose
as
aussi,
proper hand
je peux
sanitizing
souligner,
is
je pense que pour les
practiced.
adultes, c'est toujours aussi une bonne occasion,
And I think
normalement,
that also
d'avoir
for
des fêtes à
adults, this is
l'intérieur. Je pense que cette année,
a good
ce n'est pas une bonne
opportunity.
idée d'avoir des
Usually,
fêtes à l'intérieur pour les
gatherings
adultes.
and
Je
celebrations
sais, c'est
are
presque comme
held indoors,
une
Halloween parties
occasion
for
vraiment
adults, for example.
avoir
But
des
this year,
amis, pour
it's not a good
peut-être
time
prendre
to invite
quelques
friends
boissons,
over
tout ça, mais je pense que cette année, ce n'est pas une bonne
or
idée.
to have a few
Je
drinks
pense aussi
together.
qu'à l'échelle
This year,
locale, il y a
that
aussi
is
déjà
not appropriate.
des lignes directrices, des conseils pour
At the
avoir
local
une
level, we have
Halloween
seen
plus
guidelines
sécuritaire.
on
Et je
how
pense
to
qu'à part de
celebrate
ça, je
Halloween
pense que
more
nous autres,
safely.
on a déjà dit ce qu'on peut dire à
I think that
l'échelle
on
nationale.
this subject,
Merci.
we have already
Dr.
said
Tam.
what we had to say on the national level. Thank
The
you.
question was about Halloween and safe practices. I think Dr. Tam and myself, we already commented on Halloween previously. I think Halloween is a very important occasion, I think, in terms of, keeping our society going. I think I mentioned before, it's important for children, but I think it's also very important for parents, for adults. I would say that certainly doing Halloween this year in the era of COVID-19, it will be different compared to other years. It's always important to follow the directions of local public health authorities because obviously the situation differs from one part in the country to another. I would say that in general, for children going from house to house outdoors, obviously, to get candies can be done in a safe manner with good public health measures. Obviously, hopefully, people will use, other measures such as, hand disinfectants, etc. There's a good way, I think, of being able to both give and receive candies. The one thing we did maybe mention last time that I think maybe also is important to underscore is that I think in certainly the past few years I've seen that it's been a great, I think, occasion as well for adults to get together, have a Halloween party, dress up. It's a sort of a way to let loose. But I think this year it's probably not the time to have an indoor party with your adult friends and drink and be merry. So I think that would be another point to underscore. But otherwise, I think certainly Halloween could and should go ahead, but obviously following a local guidance.
En suivi, Émilie?
Follow-up question.
Oui, excusez-moi, j'ai un problème avec mon téléphone.
Yes, I'm sorry, I'm
En
having
suivi, je
telephone
ne sais pas si le
difficulties.
ministre
As a
Leblanc
follow-up
est
question,
toujours avec nous,
is
mais
Minister
si
Leblanc
oui,
still
j'avais
with us?
je ne sais pas s'il est là. Bref,
I'm not sure if he
j'avais une
is
question.
still there,
On a
but I do
parlé
have
beaucoup
a
avec
question.
M. Trudeau de ce
Mr.
projet de
Trudeau
normes nationales pour les centres de
spoke
soins de longue
at
durée.
length about national standards for long-term
Durant
care
la
centers.
rencontre d'hier, la 20e rencontre avec
During
les premiers
yesterday's
ministres,
meeting, the
est-ce que ce
20th
point-là
First
a été
Ministers
abordé et
meeting,
c'est quoi en
was
général
that point
l'accueil de ce
raised?
projet-là, la réception que vous que vous voyez
And
du
how
côté des
was
premiers ministres provinciaux et territoriaux?
your point received by provinces and
Merci,
territories?
merci pour la question. Oui, ça a
Answer.
été
Thank you for the
soulevé
question.
par le Premier ministre
This is
Trudeau
Minister Leblanc.
et
Yes,
par
the Prime
d'autres
Minister
premiers
did raise
ministres.
that point, and it was also
Comme
raised by other
M. Trudeau a
premiers.
mentionné, nous
As Mr.
avons
Trudeau
entamé la
mentioned,
conversation en disant qu'il
we
y a des
kicked off the
pratiques à travers le
conversation
pays
by
qui ont bien
saying
fonctionné. Il y a
that there are
certaines
practices
juridictions
across the
qui ont
country
eu
that have worked.
certains succès, d'autres qui ont
There
eu
have
certains
been
défis.
some
Alors,
successes
on
and
a
some
débuté
challenges
la
that we've seen
conversation en
across the
disant
country.
ce sera une bonne
So we
idée
began the conversation
entre les différentes
by
provinces et
stating
territoires de commencer à
that it would be a good
partager
idea
les
for
meilleures
provinces and
pratiques, qu'est-ce qui
territories
a
to begin
fonctionné, qu'est-ce qui
sharing
a
their best
représenté
practices,
peut-être plus de défis. Et en
pooling
faisant
their
ça, on
knowledge
pourra
on
débuter
things that posed
immédiatement
more of
en
a
apprenant
challenge.
les uns des autres.
And
Et cette
proceeding in
idée
this way, they
a
can
été bien
learn
reçue par
from
les
each
premiers
other.
ministres.
And
Et
that
c'est une
suggestion
discussion
was well
que,
received
évidemment,
by
on
provincial
va
and
continuer
territorial
d'avoir
premiers.
dans nos prochaines
And this,
rencontres.
of course, is the type of
Alors,
conversation we
tout
will
le monde
continue
était
to have
d'accord que
at our
l'idée
meetings.
de partager de meilleures
Everyone
pratiques
agreed
était une bonne
on
chose.
the
On a aussi
idea
discuté, par exemple,
of pooling best
l'implication
practices. And of
continue
course,
de la
we
Croix-Rouge canadienne
reiterated
dans
the
certaines
support
juridictions,
of
dans certains
the Red
endroits
Cross in
de soins à
certain
longue durée.
jurisdictions,
Et
in
nous
certain
avons
long-term care
exprimé au Premier
centers.
ministre notre volonté de
And we
continuer au
expressed to
besoin
premiers our
la présence du
willingness to
Croix-Rouge et comme
continue
une façon tangible que le
with
fédéral
this
pourra
presence of the
appuyer
Red Cross.
les provinces et les territoires dans des
And we
circonstances
reiterated the
d'urgence.
possibility for the federal government to support provinces
Merci.
and
On va prendre une
territories
question dans
in
la salle avant de
emergency
retourner au
situations.
téléphone. Première question dans la salle.
Bonjour, M. Rodriguez, Louis Blouin de Radio-Canada. Je voudrais vous
Louis
entendre sur
Blouin
la joyeuse
from
ambiance dans les
Radio-Canada.
comités
Mr.
parlementaires
Rodriguez,
ces
I would
jours-ci.
like to hear
On
you
comprend
speak
qu'il est
about
question pour vous de peut-être
joyous
faire
gatherings
faire
at
d'un des
Parliament
votes une question
over
de
the past
confiance
few
pour
days.
essayer de mettre fin à tout ça. Pouvez-vous nous préciser un petit
Can
peu
you tell
quand,
us about
comment,
confidence
dans quel
votes?
comité, puis pourquoi
Can
vous
you
en
tell
arrivez
us
là?
why
Bonjour,
you have
M.
gotten
Blouin.
to where you
Content de vous voir.
have gotten over the past few
Simplement dire
days?
ceci. Un, les
Minister
comités sont maîtres de leur propre destinée.
Rodriguez.
Ils prennent leurs propres décisions. Moi, je ne suis pas membre d'aucun de ces
First of
comités-là,
all,
mais
I would
évidemment,
like to
j'observe
talk
tout ça
about
avec
committees.
beaucoup
Committees
d'intérêt.
are masters
Et
of
je
their
vois
own
ce que la même chose
destinies,
que mes collègues
and we
ont
don't
vu,
control
c'est-à-dire
what
une
happens in
motion complètement
committees.
irresponsable de
I
la part
can,
des
I can tell
conservateurs,
you that the
extrêmement
Conservatives'
partisane.
motion
Nous, on
was
ne
extremely
s'oppose
partisan
pas
and
à la
also
création d'un
irresponsible.
comité. On le dit qu'on est en faveur d'ailleurs pour analyser l'ensemble des dépenses de la
We
pandémie.
want
Je pense que
to
ça peut être
reiterate
très
that we are
utile,
in
non
favor
seulement pour
of
les députés, mais l'ensemble
looking
du
at all
gouvernement et des
expenses
Canadiens,
during the
pour qu'on
pandemic
pour qu'on étudie
because we think this can
à
be
fond tout
useful
ce qui fut
for the
fait.
government and for all
Et à ce moment-là,
Canadians
les
to be
députés pourront poser
transparent
des
about what
questions,
happened.
questions qu'ils veulent.
And
Mais sur la
anyone can
question
ask
d'un
any
vote de
question that they wish.
confiance, pourquoi en arriver là? Puis il n'y a pas un
Question.
risque de
But when
prendre
it
ce
comes to a
pari-là
confidence
en
vote,
pleine pandémie? Vous allez chercher votre appui où si vous décidez de
where
faire de
will
tout
you
ça
look
un
for
enjeu
your
de confiance?
support
Monsieur Blouin, vous êtes le seul
if you
actuellement
decide to
entre nous
have
qui
a
parle
confidence
de vote de
vote?
confiance. Moi, ce que je vous dis, c'est que
Minister
il y a
Rodriguez,
d'une part
Mr. Blouin, you are the only
des
one who
conservateurs
is
qui jouent
bringing
un
up
jeu
this
extrêmement
possibility.
partisan et déplacé actuellement.
I was
Et d'autre
referring
part,
to an extremely partisan
notre
motion tabled
suggestion,
by the
et
Conservatives.
j'en ai parlé aux autres partis et j'espère qu'ils vont vouloir en
I have
discuter.
spoken with
Notre
other
suggestion à l'effet de
parties,
créer un
and
comité
our
beaucoup plus large qui va
suggestion
analyser
is to
l'ensemble des
create
dépenses. Et je
a
pense que
much
tous peuvent en
broader
bénéficier.
committee
On a
to look
investi
into all
énormément d'argent comme
expenditures.
gouvernement. Il y a des choses qu'on a bien fait, peut-être d'autres choses qu'on
And
a
it can
fait
look at
différemment.
things that were
De faire
done well
différemment,
by
un
the
comité
government,
comme ça
perhaps other things
peut
that
nous
were
aider
done
à
less well,
réfléchir et à s'améliorer.
and this can help us to reflect
Donc, je pourrais
and
être là.
to improve.
J'ai répondu, Monsieur Blouin.
You
Parfait, on
didn't
va
answer
retourner
my
au
question. I
téléphone
did
pour la
answer,
prochaine
Mr.
question.
Blouin.
Opérateur?
Merci, thank you. Prochaine question, Lina Dib, La Presse
Next
canadienne.
question from Lina Dib from the
Oui,
Canadian
bonjour.
Press.
Ma question est pour M. Leblanc.
My
J'aimerais
question
qu'on
is for
revienne
Mr.
sur les
Leblanc.
normes nationales
I'd
parce
like to
que
come back to national
peut-être
standards.
je comprends pas tout à fait.
Perhaps I haven't
Vous
fully
dites
understood.
que tout le monde est d'accord pour regarder
You
ce
were
que son
saying
voisin fait
that everyone
et
agreed
apprendre de son
to
voisin.
pool best
Ça
practices
n'a
and
rien
to
à
learn
voir
from
avec
their
les normes
neighbors.
nationales.
But that
Alors,
has
est-ce que vous
nothing
êtes
to
en
do with
train
national
de
standards.
mettre de côté cette idée d'imposer des
So,
normes à toutes les
are
provinces
you
pour la façon
ready
dont
to
elles
set
gèrent
aside this
des
possibility of
CHSLD et
imposing
autres centres
national
de soins de
norms
longue durée.
for provinces and territories which manage
Ben,
their
écoutez,
long-term care
le mot
centers?
imposer
Answer
est
by
peut-être pas
Minister
le bon
Leblanc.
mot. Est-ce que nous
Well,
sommes, comme le Premier
impose
ministre a indiqué,
is certainly
prêts
not
à
a word that we
travailler?
would
Ce
use.
que nous
Is
avons,
the federal
je pense,
government ready to work
démontré
together?
depuis le début de
I
la
think that is
pandémie, est-ce que
something we
nous
have
sommes prêts
proved
à
since the beginning
travailler
of the pandemic.
avec les provinces et
Are
les
we ready
territoires
to
afin
work
de
with
protéger nos
provinces and
aînés
territories to
qui
protect
sont
our
résidents de ces
seniors
centres de soins
living
à longue
in
durée? La
these
réponse,
long-term
évidemment,
care
est oui.
centers?
Et Et comme j'ai
The answer
mentionné, il y a
is, of
plusieurs
course,
exemples dans
yes.
plusieurs régions où nous
And
faisons
I have given a
exactement
number of
ça
examples of
aujourd'hui
different
comme
regions
hier
where we
et
have done
probablement
exactly
comme
that
demain au besoin.
today and
Euh,
yesterday, and
La
probably we
conversation a
will need to continue
débuté
in this way tomorrow as
avec
well.
l'idée de partager ce
The
qui fait
idea
déjà les autorités de santé
is
publique,
for
c'est évident.
provinces to
Est-ce qu'on peut
share
partager
what
ensemble
they are already
les
doing
pratiques qui ont
well
fonctionné? Est-ce qu'il y a des défis en termes de
and
contrôle
to
d'infection,
discuss
comme M. Trudeau a
challenges
indiqué?
with
Et
infection
c'était là le
control,
début de la
as Mr. Trudeau
conversation, mais nous ne
mentioned.
sommes
And
pas
that was
arrivés
the
à une
beginning of the
conclusion,
conversation,
évidemment.
but of course
On a
we
discuté
haven't yet
plusieurs
had the
enjeux lors de
opportunity
la
to
discussion
reach a
d'hier soir.
conclusion.
La question des soins à longue durée
The
faisait
matter
partie
of
de
long-term
constat
care
de comment le Canada fonctionne
was
dans
part
le
of the
contexte de la pandémie.
observation of
Et
how
ce sera une
Canada
discussion qui,
functions
évidemment, est à
during a
continuer.
pandemic. And this is, of course, a conversation that will
Mais Monsieur
continue.
Leblanc, cette conversation-là, vous l'avez
Follow-up
commencée au
question. But
printemps. Au
Mr. Leblanc,
printemps,
you
déjà, M.
started this
Trudeau
conversation in the
disait
spring,
c'est
and
inadmissible
already
ce
in
qui
the
est en
spring,
train
Mr.
d'arriver
Trudeau
aux
was
personnes
saying
âgées dans
that
les
it
centres
was
de soins de
unacceptable
longue durée.
what was happening to
Le
seniors in
gouvernement
long-term care
fédéral
centers.
va y faire quelque chose. Et là, je vous
Will
entends
the
encore
federal
une fois
government
reculer sur la question des normes
And I
nationales.
am hearing you pull
Non,
back
encore
from the
là,
suggestion
Lina,
of
c'est
national
pas
norms.
que
Is that
c'est
right?
désagréable, mais je
Answer.
n'accepte pas l'idée
No,
qu'on
Lina, I'm
recule.
not trying to
On
be
continue d'aider les
unpleasant.
provinces
We are
et les
continuing
territoires dans la
to
question
assist provinces
très
and
importante des
territories
soins aux
with the
personnes
extremely
âgées qui sont
important
résidentes
issue
dans les
of
centres de soins à
long-term
longue
care
durée. M.
for
Trudeau l'a bien
seniors.
dit, au printemps, pendant
Mr.
l'été,
Trudeau said
oui, on
that
avait recours à
well
l'armée canadienne,
during the
on a
spring.
encore recours à la Croix-Rouge
We
canadienne.
are still
Puis c'est une
drawing
bonne
on
chose si on peut
resources
appuyer
at
les
the Red
provinces
Cross,
et les
and this is a
territoires
good
dans
thing
un
that we can do
contexte aussi
to support
précis
provinces and
comme,
territories in
comme
such a
celui-là.
specific
Mais la
context as this.
discussion est à poursuivre.
But
Si on peut encore
the discussion
partager
is to be
qu'est-ce qui a bien
continued.
fonctionné dans certaines juridictions,
If certain
qu'est-ce qui a bien
jurisdictions
fonctionné et qu'est-ce qui
share
peut-être
what
a
worked
été
well
plus
for
un défi
them
dans
or
d'autres,
what might have
c'est un
been
début de
more
la
of a challenge,
conversation.
that
Ce
is
n'est pas une
a
question de
beginning
reculer,
to a
de reculer,
conversation.
c'est une question de
I'm not
continuer,
pulling
de
back.
savoir la meilleure façon
In
qu'on peut
fact, we are
s'assurer
continuing
tous ensemble
in
que
order
les
to find the
personnes
best way
âgées
to proceed
qui sont
all
résidents
together
dans ces
to
foyers
ensure
de
that
soins à longue
seniors who
durée
live in these
sont le
long-term
mieux
care
protégés
centers
possible.
are protected as well as possible.
Merci. On va maintenant retourner dans la salle. Prochaine question.
Next question in
Minister
the
LeBlanc,
room.
it's Mike Couture from Global National. I just want to follow up on the long-term care facilities and the guidelines. You keep saying that we're going to share best practices. The Prime Minister just said that if we didn't take that action, it would be irresponsible. So do me a favor, paint a picture for me of that call last night. As the second wave threatens to cause even more deaths in long-term care facilities, is there no sense of urgency on that phone call, or is somebody on that phone call holding it up and not wanting to go forward with more broad guidelines for everybody?
So nobody on that phone call would imagine holding up anything that will improve the care that we collectively want to offer Canadians who are resident in these long-term care facilities. So every government and every First Minister on that call obviously wants to do what they can and what we can do collectively together to improve the care that Canadians understandably expect all of us to ensure for those who are resident in these long-term care facilities. So the conversation was constructive. We talked about a whole series of issues. This is obviously an important one. It's no surprise to First Ministers that the Government of Canada shares the concern Canadians have in every corner of the country about what we can do together to ensure the best care possible. It starts with sharing best practices. A number of premiers, both on the call last night, but premiers with whom I had spoken earlier in the day yesterday, the day before, and with whom I will speak later this afternoon, are all anxious to work with us and begin that conversation. So we continue to be ready to meet the urgent needs that provinces have, as we have since the beginning, as we'll continue to do. But we want to have a longer-term conversation about what we can do together to ensure that these Canadians are looked after in the best way possible.
And just as a second question now to the room for Dr. Tam and Dr. Njoo, I don't want to try and have you oppose Dr. Vera Etches, who you've praised, but do you find that it's difficult in terms of messaging? Because the two of you are sitting here saying Halloween in certain places, and yes, listen to your local guidelines. Halloween is a good thing. But then you have local officials saying, not here, don't do Halloween. In terms of the messaging, are you concerned that Canadians will either listen to you or listen to Dr. Etches and just pick and choose who they want to listen to based on, well, one doctor says the thing that I want to hear, the other doctor isn't, so I'm just going to listen to that doctor. Is that something that you've faced or are cognizant of in terms of a difficulty in the messaging around COVID-19?
Well, I think, in fact, we were quite aligned with our messaging in that Dr. Etches would say, yeah, I mean, at the national level, there's broad guidance, but that I recognize the fact that in Ottawa is different than in another area of Ontario. So I think that reinforces the message for people that it is not the same epidemic activity across Canada. We're trying to do this balancing act of getting people back to more closer to normality. It's not going to be the same this year, but it does depend on what's going on locally. So we always say, please check in with local health authority. There are different ways of still enjoying Halloween, though, depending on what your local health authority the messages are on influenza activity. So definitely that's your first stop. But we got other suggestions based on guidance. So if you had to sort of not go out, like Dr. Etches says, you know, in Ottawa, trick-or-treating is probably not a good idea. Now, we've got suggestions, which is, of course, lots of other fun things that you can do. You know, virtual costume parties, pumpkin carving outside on your driveway, have a scavenger hunt at home with your family. You know, there are things that might be organized at school, you know, where there's all, you know, structured approaches to getting kids to enjoy themselves. But we have a common goal, which is trying to give kids some fun in the safest way.
Thank you, Dr. Tam. We'll go back to the phone. Operator.
Thank you. Merci. Next question, Alpiraj, HuffPost Canada. Line open.
Thank you. My question is for Minister LeBlanc. The Prime Minister this week, when he was speaking to Manitoba radio station, talked about how some provinces have not hit their agreed-to targets when it comes to testing. I'm going to basically give you a couple of rapid-fire questions. What provinces have not hit their agreed-to targets? He also talked about contact tracers. You talked about capacity, but how many federal employees are actually doing contact tracing, and which provinces are they supporting? And how much of that $19 billion that was agreed to in July has actually gone out the door?
So, Althea, congratulations. You put a whole series of technical questions into one. What I can say is the Government of Canada obviously recognizes the importance of testing in terms of controlling and helping provinces and territories control the spread of COVID-19. Dr. Tam or Dr. Njoo may want to provide some specific answers in terms of how many tests have been achieved. The doctors gave a sort of daily average over the last 7 days. Different jurisdictions at different times, because of a surge in testing demands, have had to catch up. I think what, from our perspective, was very positive is a number of provinces stepped in to help other provinces during these particular surges. So tests done in Ontario might be going to laboratories in my province in New Brunswick or in other provinces. Everybody really wanted to help out to assist these jurisdictions in achieving the maximum number of tests possible. Obviously, the arrival of some of the rapid test instruments that are arriving this week and being shipped to provinces this week and will continue again next week, that will assist directly in improving this capacity. And contact tracing, as Minister Hajdu has said on a number of occasions, contact tracing on our part can be augmented by offering provinces and territories people from Statistics Canada or other trained people that can help provincial and local authorities double down in terms of rapid contact tracing. But perhaps Dr. Tam can answer some of the specific details on how many tests and contact tracers are currently being deployed in different provinces.
I think, you know, we track the daily testing numbers, as everybody knows, and it's, you know, the details for the provinces will be available on our website. But I do have to reinforce the fact that people are trying to help. So I think, as the minister said, if one jurisdiction has some sort of backlog, we are trying to provide surge from our own federal laboratories, and not just the National Microbiology Lab, but some of the other federal labs that have now been trained by our lab to retool and do some of these tests as well. But that, you know, across jurisdictions, some province will help others if they have the extra capacity as well. So I think that's what I want to emphasize. The rapid test will be another addition to the capacity, but I also just want to stress that, you know, we have published now new guidance on PCR and on antigen testing. People need to try and look at those guidance and align the recommendations for testing with those, because each have their own particular use, and you need to sort of have the right test in the right sort of place and the right people that you need to be testing. So, but you know, we're augmenting capacity every day, and but I think from the federal perspective, as we allocate things like antigen tests, there will be some holdback for surge capacity so that it can be directed to more of the hotspots.
Thank you. So I'm going to go back, to go back to Dominic. And yes, you're right, I'm putting a lot in there, but that's because the answers are not very forthcoming or at all from the government. So I'm sorry to use this opportunity to ask you that question. But if you're basically suggesting, the Prime Minister is basically suggesting that Ottawa has done its part, and actually that's a quote from you, we are doing our part, you seem to be suggesting that the provinces have not held up their end of the bargain. So what provinces have not hit their agreed-to targets? And when you say that you have all this capacity, well, how many federal employees are actually being used, and how much of the money that you have pledged to give the provinces has actually gone out the door?
So in terms of the money, obviously of the $19 billion, which was identified for a series of priorities that we agreed to with provinces and territories, a great deal of it was around contact tracing and testing. I think it was over $4.3 billion of the $19 billion. Over 50% of that money has already been transferred to provinces, and the rest will follow an agreed upon schedule. The nice thing is if you sign an agreement with the Government of Canada for an amount of money that will be transferred, you can rely on that transfer. In fact, a receivable from the Government of Canada is actually bankable. You can borrow money on it. So the provinces know on the agreed upon transfers of the rest of the money. But in terms of how many contact tracers in each jurisdiction are operating today, maybe Dr. Tam or Dr. Njoo has that information, or we'd be happy, Althea, to provide details as of today, how many people were working in different jurisdictions doing this contact tracing in support of provincial and territorial partners.
Yes, I don't have the numbers in front of me, but we can follow up for sure.
Thank you. We'll take it back to the room.
For CTV News, this message for House Leader Rodriguez. The Conservatives will be forcing a vote to create an anti-corruption committee. Would you consider this a matter of confidence in the government?
Well, as I said in my previous answer, Conservatives on their side put forward a very partisan motion, a very irresponsible motion. What we're doing on our side, and we're totally open to having a special committee on pandemic spending. There have been lots of programs put in place by the government to help Kenyans. It would be very useful to have a committee to look through all of that. There's things we can learn on the government side. It would be good for MPs, good for the government, good for Kenyans. They could ask all the questions they want, but that would be a real committee where real work is done, not something partisan like the Conservatives are proposing.
Would you be opposed to putting a opposition MP at the head of this committee, or it doesn't sound like you really are in favor of an anti-corruption committee. You're in favor.
Well, again, I mean,
a different.
But again, this is total pure partisan politics. in my mind, which is totally unacceptable in any time, especially during pandemics where our public servants are working really hard to deliver the programs. The government is working to deliver the programs, and they come up with this. I think they could do better, to be honest. They could do better than this. I invite them to join us in this effort to let's create this special committee where we can look at all the pandemic spendings in a responsible way. And they all have my phone number, and if they want to chat about it, I'm free all day.
Thank you. We'll go back to the phone. Opérateur, c'est à vous.
Thank you. Merci. Next question, Greg Quinn, Market News International. Line open.
Hello. I was wondering about the balance I've seen at the provincial level where some provincial leaders were seemed to want to keep restaurants open even as the caseloads were rising. And this came in the fall when many parents were sending their children back to school. You know, what is the right but difficult balance between protecting the economy and making sure children have a safe environment to go to?
It's Dr. Njoo. Maybe I can start off, and Dr. Tam can also add to the response. I think it's a false dichotomy. You're talking about sort of public health and quote the economy. I think they're intertwined. It's not a sort of a either or. I think obviously you need a sort of a healthy population to have a healthy economy, and I think the two are intertwined. So I think certainly what we're looking at, and it's certainly we're learning from our experiences collectively, not just here in Canada but around the world, is as we flatten the curve in the spring. How do we, in a very, how you say, deliberate way, based obviously on the evidence and experience and the scientific sort of knowledge that we're gaining, open up in a sort of a deliberate way that also balances sort of the risk to public health with obviously trying to get back to as normal as we can, sort of the way we were before. And I think as we're learning things about asymptomatic transmission, what the role might be of droplets and even tinier droplets, and what some people might call aerosols and so on, that all comes to play. And so I think when you're talking about be it restaurants or schools and so on, they're all a reflection of what's happening in the general community, the general sort of level of transmission. And so I don't think they each sort of exist in their own bubble. And there's certain things that governments can do at both a local level and obviously at higher levels as well, in terms of regulating and seeing what needs to be done in a very targeted way, hopefully, to address what's happening locally. But at the end of the day, as we've mentioned previously many times, that it does also come down to individual behavior by Canadians in terms of, we keep mentioning it, the physical distancing, the use of face coverings, the good hand washing, hygiene, etc. So I'm not sure, Dr. Tam, if you want to add to that.
I think just to reiterate that to protect the population and supporting the economy, as Dr. Njoo say, is not one or the other. Controlling the virus and the level of transmission is extremely important with respect to society, social and economic factors as well. And so I think the two go hand in hand, because if the virus surges and it becomes unmanageable, and that results in further restrictions, that's not good for the economy. So we've both public health organizations and individuals have to help keep the transmission low, primarily by minimizing the number of contacts, for example, will actually really help prevent this sort of ups and down in impact in the economic sector.
Following up, Greg?
No, that's fine. Thank you very much.
Mia, would you like to go?
Dr. Tam, we have a question about risk and how you decide using sort of risk formulas or some kind of formula when you make an order for people not to do something, or you just strongly advise it. I mean, I'm thinking Halloween in Ottawa, we're not being told you absolutely can't, you're just saying please don't. But when people are coming in from the border, it is an order that they have to stay home. If you have symptoms, we advise you to stay home. How do you make the choice between an order and just a basic advice?
I think partly relates to the jurisdiction of where the regulation pertains to. Of course, for the federal government, the international border is, our responsibility. So the Quarantine Act, for example, is set up to, in a way, to try and minimize risks for Canadians. So as you know, in terms of, there's still restrictions and with both the US and non-US countries, and also in terms of the 14-day mandatory quarantine for incoming travelers is still in place with few exceptions. So now I think part of it is related to epidemiology. So if you were in different localities, so Toronto, Ottawa, Peel, for example, is a different level of viral transmission risk. So you will, some of the factors that local authorities will decide on whether, asking people to do the right thing is enough or that further restrictions are required. And so that is more sort of pertaining to the provincial or local jurisdiction that they can or cannot order based on their own regulatory frameworks. But I think in general, I think trying to get everybody on side to do things voluntarily is always the first step. And then if that actually doesn't work, then restrictions may have to be applied, as you've seen in some of the places in Quebec or in Ontario. But I would say that it's based on a number of epidemiologic indicators based on whether your healthcare system is still managing things and whether the public health system is able to keep up with the testing, contact tracing, and isolation and quarantine. So it's not a singular factor. Some jurisdictions have provided some triggers and levels of which they are basing their advice to their population on as well. So I think always start with, as much as possible, voluntary, but if necessary, local jurisdictions will do what they need to.
We'll take one last question on the phone. Operator.
Thank you. Merci. It is from Marika Walsh, the Globe and Mail. Line open.
Hi, Minister Rodriguez. Thanks for taking my call. I wanted to clarify, are you in support of an opposition MP chairing this special committee that you're now saying the Liberals are in agreement with?
Well, it's up to the committee members to discuss that. What we're open to is definitely to have a special committee on pandemic spending with, regular members and with the capacity to ask all the questions they want. I think it's something extremely positive. I think it's something that allows us to examine all the areas of pandemic spending. There's been many programs that were there from day one to help Canadians, and the members could ask any question they want on one or the other of the programs. And this would definitely benefit all of us, the MPs, the government, the Canes, and could even help the government to improve some of the things we're doing.
And just going back to the questions that both my colleagues at CBC and CTV have already asked you, what should we take from the fact that you're not ruling out turning this into a confidence vote?
Because I'm focusing on trying to create this special committee, as I've mentioned before. I raised this with my counterparts in the other parties. They know that I'm always available. They all have my cell phone. I think this would be something extremely positive for all of us. I would say for all parties, for all parliamentarians, for the governments, and for Canadians. So this is what I'm focusing on. Serious work with a serious committee.
Thank you all. This is what ends today's presser. C'est ce qui met fin à la conférence de presse d'aujourd'hui.
Thank you. The conference is now ended. Please disconnect your line.